Good morning, lovelies. So nice to see you. My name's Alya and I'm really happy that you popped in. So today we're going to be talking about double vision. What is it? What does it mean? What do you do if you get it? And what it's really called, diplopia. And we're just going to be talking about how to tell if you really have it or if it's just confusing you about something else and all these good things, and as well as creating this exact look. I hope you like it. And we're also going to be a little bit confused for the first few little minutes because I'm not wearing a blue dress to match my blue tickle. I've got this old leopard print thing on, and the reason is I just didn't want to get this dress dirty. So I hope you join in. So I'm definitely starting with a bit of skincare and then jumping over to the beautiful eye look. I hope you like it as much as I do, and talking about seeing double. So I'm going to definitely start with my beautiful concoction because no day can start without it. I love to always concentrate on what I consider my problem areas. So under the eyes is definitely something that maybe not now, but eventually becomes a problem. You get puffiness, you get some wrinkle tendencies around there. So I always put a little bit extra there, and I put a lot on my, what I refer to as my second chin, because this area to me is it's a current problem, right? So, and then just nicely and gradually, without trying to tug the skin at all, so very lightly, using just the pads of my fingers, massaging it all in. Okay, so now we're ready to start. So now that the base is on, eyebrows are done, I'm much more comfortable getting into the makeup. My big reason for choosing this topic today is because of how much confusion it attracts. I have a lot of people that come through the clinic for various reasons and they complain of double vision. Now, the first thing to get out there is that double vision is only true double vision, and the type of double vision that we're going to be talking about today, diplopia, is if when you close one eye, it goes away. If it's coming from one eye only, it's not double vision. There's something wrong with specifically the eye that's blurry, and it could be something as simple as you need to change your glasses, or you need glasses, or you've got dry eye. There's a myriad of reasons why the eyes might be blurry. You might have some sugar issues, so diabetic questions there, or blood pressure. All those things can certainly affect blurriness in your vision. Medication is another one. The list goes on. Real diplopia, true diplopia, has to happen from two eyes together. So what we're talking about is a misalignment, for whatever reason, between the left and right eye, and it means that they no longer can work as a pair. We spoke about amblyopia in the last video, which is a problem, or lazy eye, which is a problem that children pretty exclusively get, and that's because it relates to developmental vision. Here we're talking about an adult, usually, with established vision. So the brain's done its growing, it knows what to expect, and suddenly those expectations change due to some of the things we're going to talk about today. One of the main things we need to be ruling out is things that are very dangerous, like stroke, like diabetic changes, like growths, tumors, and so forth and so on. So we'll be talking about all the different things to look out for, what to expect, types of diplopia, all that kind of thing in today's video. So yeah, if you're interested, please do continue to watch. So for my base, I have my sunscreen on, this beauty. I've got my minerals on, this beauty. I don't have anything else yet on, just the eyebrows, thanks to this little guy. So all that stuff's done. Jumping into some eyes. How can you tell if you have double vision? To me, the first thing as a clinician that I look for is, does it exist with one eye or two eyes opened, as I mentioned? Once you can confirm that it is in fact a difference between the two eyes, get someone to have a look at your eyes. Do they go all the way left and right? Okay, and when you're in the far left, up, down. When you're in the far right, up, down. And when you're in the middle, up and down. And if both eyes move together in all the 9 positions, then so far so good. Then that's definitely a clear indicator that there's no particular palsy or anything like that. Of course, you do need a clinician to really check. It's not that simple, but you can at least do a quick at-home check for that. The next thing I would be looking at is, does it change throughout the day, or does it change depending what you're doing? So is it worse when you're reading, or is it worse when you're looking far away, like the TV, or when you're driving? And just a note of that, if you are getting a little double vision and you are driving, I would highly recommend that if you can stop, to stop until you see a clinician and can be cleared for driving, because it's quite dangerous if you can't judge distances all of a sudden, or you can't judge, different things like where the cars are starting and stopping in front of you, things like that. So it's a little bit dangerous to drive with a change in your vision. The other thing to consider is, does the double vision go away when you have your glasses on, if you wear glasses, or when you have your glasses off? So if it's worse with your glasses off, it could just be a big change in your prescription, which can happen. It could also be due to some changes between the two eyes, and the eyes aren't coping with being so different all of a sudden. And those type of changes can be a little bit dangerous, and sometimes they can be completely innocent. So once again, it just indicates the urgency of presenting to an eye specialist. Sometimes if it's just something fairly mild or fairly progressive, a GP, a general doctor, can help you, but mostly your family doctor will probably refer you on anyway. So try your best to present to someone who understands eyes pretty early in the picture, I would say. The different types of things that can cause the muscles and the nerves of the eyes to change are usually neurological in nature. So they usually relate back to the nerves inside the head. We have several very important nerves that control the eyes. So obviously we have our optic nerve. We all kind of know about that one being a part of the eye situation, but that nerve only really is responsible for sight. So it only really passes on messages of light that come from the back of the eye. That nerve is not going to do anything for the eye muscles or the eye movements. The nerves that are responsible for eye movements, the ones I showed you at the beginning, are responsible for the extraocular muscles. Okay, big words as always with this. Extraocular muscles control horizontal movement. That's why we can go side to side, in and out, and we can control focusing up close where our eyes tend to come together, and then changing for the distance where our eyes straighten out. Those muscles, we've got two muscles on either side there that are pairs with one another and can cooperate with one another pretty well. Got a short, juicy, meaty muscle in here, and then you've got this thin sort of stretchy muscle out the side, and they control those movements. Each of those have a different nerve controlling them though. So the nerve that controls the external muscle is only responsible for that one muscle. So just the side muscles there, the one that is currently pulling my left eye that way, and then the one that's pulling my right eye that way. That's got its own nerve. And a lot of the time when you see horizontal anomalies, which are purely horizontal, you kind of know that it's just that nerve, just the sixth nerve. The other nerve that we have, your medial muscle here, the internal muscle here, has a nerve supply by a nerve that is responsible for so many parts of eye movement. It's the cranial nerve number 3, and that's referred to as the oculomotor nerve, and because it just does so much in terms of how we fuse things, how we adjust to things, and obviously how we blink even, and all that sort of good stuff. So it's a really, really big old nerve, and it supplies so many things. So if something goes wrong with the third nerve, it's going to be a little bit messy about what kind of effect it's going to have. And it will all depend on what kind of a palsy, where in the brain the issue is, and it's very, very complex. So if you feel like your eye is a little bit squinty or a little bit crazy, or something's suddenly going pretty wrong, you really do need to go to either a neurologist or an ocular neurologist so that they can really assess everything. A lot of the time with these assessments, you will need either a CAT scan or an MRI to really determine where things are going wrong. That's very important. Sometimes these tests can be a little bit pricey, but they're so well worth it, because you could be looking at some serious brain changes, and you need to know where you have a problem. A lot of the time it's very simple and far less expensive to start with a specialist, because they can rule out many things. They can definitely put your mind at ease, and they can really direct you in the right place for further testing, especially that a lot of the time it may not even be necessary. So again, highly, highly recommend having it tested, and do not wait on these things. Do have someone look at you pretty quickly after it happens, because if it is, say, a mini stroke, you want to know about that so that you can avoid having another bigger one that's going to be a lot more scary to your health. Finally, we've got one more little nerve that infiltrates just one other part. We have a little tendon here, just like a little hook right into the brow, called the trochlea. And the nerve that controls that movement kind of causes the eye to twist. So when our eyes go up and down, they're not actually just going up and down. what it is the 4 muscles kind of controlling how much the eye is twisting out, how much the eye is twisting in, and how much the eye is being pulled up and down. So there's a lot involved in every single eye movement, even though they're really easy to make. And the reason we have that function is because when we tilt our heads, for example, our eyes are actually staying straight. So my head's twisting, but my eye is actually staying relatively straight. And the reason for that wonderful ability is because of these 4 really cool muscles that work so synergistically together, such a good little team, that they keep things going absolutely level for me, even though my head's going boppity bop side to side. Now, having said that, all those horrible things that could be happening are a potential cause for your anomaly and potential cause for your double vision. It doesn't mean that that's what's going on at all. Sometimes things just get a little bit out of whack. It does definitely happen. Sometimes, especially with age, our muscles just get a little bit weak. And it could be even just from severe fatigue. It could be as a consequence of a migraine, for example. Headaches can definitely do funny things to us. And it doesn't even mean that there's anything permanently wrong with you. All it might mean that you need a little bit of eye muscle exercises. My favorite one, and please don't do this without being confirmed by a specialist that this is what's good for you, but I'm just going to demonstrate one very fun, kind of easy muscle training exercise, and that is having one thing that looks exactly like the other. So see how those two are very similar objects? You can use a pen if you don't have a makeup brush. One gets pretty close, as close as you can fuse it to your nose, and the other one will be as far as your arm can stretch, and then just line them up so that they're intersecting in your side, and go between focusing on the back one and focusing on the close one, focusing on the back one, focusing on the close one, and you'll see how my eyes change position, how they go more outwards and then more converged, more cross-eyed, more straight and more cross-eyed. And that's just as I train my medial rectus, my horizontal muscles, to focus and focus. So it's a really great focusing exercise, especially if you spend a long time on the computer. You're not actually suffering from double vision, but you're just fatiguing quickly and you want to try and strengthen your muscles. That's such a good one. Or if you feel like you're having a really hard time focusing after a long day, doing that for 20 seconds, I wouldn't do it for even a whole minute. I would just do a short little burst exercise like that, and then relax. The other really good thing for double vision that happens just from fatigue, just from overusing the eyes, is just closing your eyes for 20 seconds, looking out a window for 20 seconds, closing your eyes for 20 seconds, and then you can go back to the screen. So I refer to that as the 20-20-20. So the idea is that you are switching off completely any visual stimulus. You're allowing your muscles to fully relax, and they only fully relax far away, because when we're focusing, as you saw in my exercise, they're constantly in a different stage of crossed, whereas far away they're fully relaxed and they're at their most neutral position. So I've got a window behind me, or behind you guys, in front of me, and so I'm able to take a break from the computer screens or the camera screen and look outside into the beautiful blue sky, and just relax my muscles and stop them from being so focused like they are when I'm applying makeup, for example. So makeup is complete for the eyes, dress is changed, and it finally makes sense that I'm wearing a blue Tichel, even though I was wearing a leopard print dress before. So as I complete this look, I also will tell you finally what to do if you do think that you're experiencing a little bit of vision stress or double vision. Maybe it is real double vision. First thing I would do is take myself to a specialist. I would not wait on it at all. It might even be something that if you are very concerned, or it's a very extreme vision change, I would even go to an emergency department with this. It could be that serious. You have to consider your general health. You have to sort of weigh up, are you generally a healthy person? Is this sudden? If you're someone who suffers from migraines, I would be concerned. If I'm someone who has vascular disease of any sort, I would be concerned. Age is a concern, definitely. The older you are, the more likely things can happen to the nerves and muscles. And the other consideration, and always a big consideration, is diabetes. So if you have diabetic or any kind of chronic condition like that, that's also a big risk factor for a lot of things. And so I would definitely present sooner rather than later in those situations. However, if you're fairly young, and I'm saying sort of under 70 or under 65, and all your troubles are coming on or starting because you've been doing a lot of reading or a lot of computer work, or you're just tired, or you've just had a really big night, or you've had a drink the night before, or you're just coming down with a bit of a cold or something like that, and that's causing your double vision or vision fatigue, don't necessarily rush. Definitely consult your family doctor for sure. I wouldn't leave this alone altogether. Maybe even pop into the optometrist, because usually optometrists are more accessible and more affordable, and they can definitely give you the first general assessment. But if things get worse, or if things don't change and don't improve quickly, like the next day, I would definitely be escalating things and coming back to my family doctor, coming back to my optometrist, or presenting at an emergency department. Because when it comes to eye muscles, or when it comes to eye nerves more specifically, we're talking about brain activity potentially. And anything that happens in the brain, I personally don't like to wait on. A lot of the time, it's not so hard to assess, and it's better to know that nothing's wrong than to live with the idea that something might be wrong. So as always, guys, I hope you really enjoyed today's video. I hope it was informative. I hope that I've not opened too much of a Pandora's box and set in panic, but just informed you guys so that if anything should happen to you or someone you definitely know what to do and how to approach it. And that may mean not having any reaction at all and just telling them, just calm down, see how you go, take a few blinks, use some lubricants, just really, really talking people down from panic. Or the other reaction would be, oh no, I do think this is serious, and encouraging them not to wait on it and present to a health professional. For more fun things and life updates and all that sort of good stuff, please head over to Instagram. If you'd like to contact me, I'm very contactable there. So please do feel free to jump on there. Everything that goes up on Instagram also goes over to my Facebook page, so that if that's more accessible to you guys, by all means. If you haven't yet subscribed, please go ahead. It's so simple. Just hit the button and go ahead, and it changes color. That means you're on board. Wherever you are around the world, lovelies, I hope you're having an amazing day. You're well, you're safe, you're happy, and I can't wait to see you on the next one. Bye.